Hello friends. So today let's discuss about the Ambu bag. So whenever you all are in the exam, at the time examiner may give you this bag. So look at this bag, and this is the bag from which examiner may tell to take this instrument out, and this instrument may contain other things also, like all these things, right? Let's discuss one by one. So once you remove this Ambu bag, then there is a, so this is the instrument. We call this instrument as a Ambu bag, AMBU. They may ask about the full name of the Ambu bag. So A for ambulatory manual. So you can take this instrument anywhere and you can use it. So it's manual breathing unit. Okay, it's a AMBU, ambulatory manual breathing unit. So first question is they may ask you about the full name of this. Second thing, they may ask about the capacity or size of this instrument. So this is for preterm. This bag contains around 250 ml. Second one is a term babies we use in NICU. It is for 500 ml, and then 1 liter and 2 liter for pediatric and adult also. So generally they ask about the 250 and 500 ml only. Then they may ask the second question, tell me the parts of Ambu bag. So you can start from the outlet, patient outlet, right? This is a patient outlet, right? So say this is a patient outlet and this is a patient inlet. See, this is the inlet. Okay, this one is the oxygen inlet, or for oxygen central oxygen line. We connect O2 line here, and this is a air inlet, right? So this is a patient. So if we believe that this is a patient, then we patient's mouth, like so it goes like this with mask. So, third question, they may ask you about the size of the mask, how to attach the mask. So for this, you have to hold this mask with your thumb inside the mask, hold this mask like this, and then you have to fix it by rotatory method. Generally all examiner mostly agree with this method. So how to attach the mask? Let me demonstrate once again. Take Ambu bag, take mask like this. You have to put mask and then rotate and then fix it. It is fixed. So now this is next question. They may ask you about the how to check the Ambu bag, it is working or not, right? So for that thing you have to place this mask over your palm like airtight. Fix it on your palm. For that thing you have to put your fingers on this thing and then press it. So here air is leaking from here, but valve is not opening. In such case you have to just rotate and then see, right? So then next question, this is the demonstration how to check the Ambu bag. Next question is, what will you see while you are checking the Ambu bag? So the gush of air coming out from the palm, one thing. Pop-up valve is properly working. Self-recoiling bag is working properly. Silicone or PVC bag is working properly once you compress this thing and it's come in the normal position as it is. So these three things you have to tell to examiner. Then other thing they may ask you about the how many valves are there and when you can see. So you can see here there is a fish mouth valve, right? In my exam I was showing this valve like this. Don't show valve from here. So this fish mouth valve or one-way valve or outlet valve from here only, right? This is a fish mouth valve. Second is, this is a pop-up valve or pressure release valve. This is a pop-up valve and pressure release valve. Here there is also valve. one way valve is there for air inlet, right? These are the 3 valves in the Ambu bag. The individual work of all these 3 valves is for a fish mouth valve. It's one way valve. Air goes in the patient's body, but when patient exhales, it doesn't go in the bag. So patient may get more oxygenated air, right? This is a pressure release valve. So whenever there is a higher pressure we are giving, or patient is not required that much pressure, then this will release the pressure like in a pressure cooker, right? So this is a pressure release valve which prevents the barotrauma and lung injury while the resuscitation. This is also one way valve, so air goes in, doesn't go out, right? So next thing, examiner, if you are going well in your Viva, then examiner may ask, you are saying that fish mouth valve is one way valve, right? So air is going inside, but when patient exhale, where air will go? So here is the space where exhalated air, expirated air will go out from here only. So in my exam I was not knowing that thing. Second thing, reservoir. This is a oxygen tubing may be provided to you, where you will attach this thing. So we are going to attach this thing from like here only, and this source is going to attach with oxygen cylinder or central oxygen line and all. So this is the thing where you can attach the oxygen tubing, right? This is the oxygen reservoir bag. You can see it's a 600 ml oxygen reservoir bag, right? So where you can attach this thing here, right? This is the oxygen reservoir bag, right? But in between Ambu bag and oxygen reservoir bag, I don't have that connector here, but we need connector also here. So in that case, they may ask what is the need of that connector we are using in between Ambu bag and oxygen reservoir bag. So you have to say for air inlet, or we need that connector, because that connector is also containing one way valve, which allows the air to go inside the this Ambu. So this is all about the Ambu bag. One more thing, they may ask you about the Ambu bag is how much percentage of oxygen will this thing deliver to the patient. So when we are using this unit only, Ambu bag only, then it will deliver 21% of oxygen. As we all know, the 21% oxygen is there in air, right? So second thing, when we attach this oxygen line or central oxygen or through oxygen cylinder or anything, then it will deliver up to 40%. How much? 40. Simple single unit 21%, with oxygen it's 40%, and with this reservoir we can deliver up to 100% of oxygen to the patient, right? So now let's revise quickly this Ambu bag. Full name of Ambu bag: ambulatory manual breathing unit. This is the mask which contains 0, 1 and 2 size. How to attach? Hold this thing, hold this Ambu bag like this. Put your thumb inside the mask. By rotatory you can fix this. It contains 3 valves. This is a fish mouth valve, this is a pop-up valve, and this is a air inlet valve, right? So this is the self-inflating silicone bag. This is the oxygen inlet, this is the air inlet here, this is the air inlet, this is for oxygen reservoir. So this is all about the Ambu bag. Next we will discuss about the another instrument. Thank you for watching. Please share and subscribe. Thank you.